I'm joined this morning by a very busy man, Troy Clifford, joining me on the line. Now, Troy is the paramedic unit chief for here in Osoyoos on the front lines in the paramedic world, but also, Troy, the ambulance paramedics of BC and emergency dispatchers of BC president. So, Troy Clifford joining me this morning. Good morning, Troy.
Good morning, Brock, and all your listeners.
Yes, you are one very busy man right now. First of all, Troy, 4,500 ambulance paramedics and emergency medical dispatchers in the province. How are your members holding up during this COVID-19 crisis?
Well, surprisingly, they're doing actually fairly well, despite all the things. This is really what we do every day anyway. It's just on an enhanced and, heightened awareness and anxiety and all those sorts of things level. So it's more of a prolonged event. So, we're faring well. And I think that really goes to the diligence of our members and our paramedics and dispatchers in not only in our resilience, but in our training and experience. We deal with crises and mass casualty incidents. I've been saying that for a little while. This is like a prolonged large event for us. So it does take its toll. There's no question. They're scared. They're anxious. They're worried about their family. They're worried about our patients, the communities. They're dealing with all the things that everybody's dealing with, but they also have that heightened responsibility and anxiety, if you will, of the work-related things. The scared, dealing with people and their frustrations and anger and misinformation. So, I think there's all those things that we're dealing with that are tough. There's, we're trying to manage high situations like this, but again, the pandemic at this level is something the world's never seen. So
that's true. Yeah, absolutely. Now, Troy Clifford, again, you have the role provincially, you have a role locally here in Osoyoos. Let's speak about your experiences and your members' experiences here in Osoyoos, how the community, how the South Okanagan is handling the pandemic. And I guess it's kind of challenging considering the age of the population and also our location, how close to the border Osoyoos is. It causes a few, challenges for your members in this area.
For sure, that's you hit on some key points there. That it's unique. You mentioned that we're all across the province, so we have a broad spectrum of communities and situations, and it is unique in Osoyoos. We all love our community. Or the South Okanagan is a beautiful place. You're right; it's proximity to the border, and the measures the federal government and provincial governments have put in place with the borders, and I really believe they're working. It's causing a lot of change and some disadvantages for us all. Our practices of crossing the border routinely, it makes you appreciate what we had before, and this has really but those measures are to protect us all. And you mentioned those people that we're trying to protect. We have a lot of seniors and retirees that are of that age, that vulnerable age bracket that is more susceptible to COVID. And it affects all ages, but that's why we got to protect areas particularly like that, put measures in place, and so we can look after our patients. It's tough. But I think everybody overall is they're following the guidelines, and then by what Dr. Henry and Adrian Dix have mentioned on Friday, it looks like we're winning to flatten the curve, which is a good thing.
Yeah, it is. It is. Looks like people are doing their part, and but also, at this time, it's challenging because everyone's highly aware of their own, how they're feeling and they're breathing and they're coughing, they're sneezing. But there are times out there when there are serious injuries or serious health issues that aren't COVID related. And a message from you as the president of the Ambulance Paramedics of BC and Emergency Dispatchers of BC. Don't be afraid to call 911 if you're suffering from a serious ailment, right?
100% right. We need to public, they're scared. They don't want to be a burden on the system. Whatever their reasons are, denial or anxiety around the whole having to go to the hospital or call your doctor or get help is a real fear. And then you exacerbate that by adding on what we're all facing right now with COVID. And we just don't want people, if they truly need our help or medical assistance, to at all hesitate. We have safety procedures in place for both our paramedics with proper protective equipment and training as well as we have the proper precautions to put in place for patients. So you're safe. They're safe to call us and go to the hospitals and medical facilities or their doctors, whatnot. We need to make sure that people understand that, we're there for them. So is the medical community, everybody's there. And, although you're not seeing the numbers, which is a good thing in places like the South Okanagan, we need to make sure that that's sustained.
Now, also something that you are doing, or the Paramedics of BC doing, is virtual care, because you're able to I guess, work with patients or clients, people in distress, and do some virtual care for them as well. So there's no, physical interaction. Is that right?
Yeah, so Osoyoos is one of the communities that has that was identified around the province a couple of years back as putting in what we call the community paramedics. And we actually have a full-time paramedic in Osoyoos, a local man named Todd Kuntz, who is our community paramedic there. And what he is integrated into the community and providing wellness checks, support in the community. He's a full-fledged working paramedic, but his role is community paramedic. And there's lots of history with that, what it is, but it's really a support in the community, liaison, looking after people that need extra care, wellness checks, diabetics. He does a lot of stuff around, opiate awareness, community awareness. And so he's not able to see his clients the way we used to. So what they've developed is a virtual way of having meetings. So a little bit like the medical community, how they've done your virtual doctor, it's a similar program. And so that's a way we've adapted to change. And I think it's a really good way to enhance that program moving forward. So it's a really, really good adjustment that BCEHS, our employer, and our community's made. And people like Todd Kuntz, who's a great community person. He works at the fire department as well. He's just integrated in the community, and he's a perfect fit for that type of role in those communities. And his support has been amazing. So, we're now able to help these people at home without visits. So we've adapted.
It is a new reality we're in right now. Again, Troy Clifford, he's the paramedic unit chief here in Osoyoos, also president of the Ambulance Paramedics of BC and Emergency Dispatchers of BC. Troy, we really want to thank you for all that you and all your members do. Not just now, but throughout the year, with all that work that you do with the public and keeping everyone safe. If people have more questions about what's going on, what they should do, how do I handle this, how do I handle that, what would you suggest to do? A website or to contact 811, or what would you suggest? For sure.
There's a couple of things. If you're looking for information, we encourage people to look on reliable information is what we've been messaging. So that things include the self-assessment tool on COVID-19, sorry about that, and 811 and the Provincial Health Office really are the ways. There's some government reliable Provincial Health Office information. All right, Troy Clifford again. Thanks once again for all that you and your members do throughout the year, and we wish you a great day, a great week, a great year. Stay safe and healthy, and we will maybe catch up with you again in the near future. For sure, Brock. Thank you for having us on, and again, be well, and our best wishes to everybody out there. We're going to get through this.